Each year we see 9,000 patients in the symptomatic breast service, but the facilities are less than adequate. There's a lack of privacy and there's sometimes inadequate seating. We're looking to build a new facility on this site here, where we're hoping to put a 3-story building with 900 square meters to make it a private, much better facility for our patients to be seen and treated for breast cancer. We'd like your help. We have €4 million raised and we've 1 million to go.
So the patients that are here today are here for what we call a triple assessment clinic. That is for clinical examination by a consultant breast surgeon. They'll have their imaging done in the radiology department, and if a biopsy is done, that's analysed by a histopathologist. That's triple assessment. Okay, so the patients are here. They're seen by a consultant breast surgeon. They have a full breast examination. After that breast examination, we send them down to the radiology department where they will have a mammogram and a breast ultrasound. And if it's deemed necessary, they will have a biopsy, and that tissue is sent off for analysis by a consultant histopathologist. So after they've had their breast exam, we need to direct them to the radiology department, which is in another part of the hospital. It's quite a distance away from our clinic. So we direct them down there. We often have to direct them or even sometimes escort them down to this department, and this takes us away from our main role here in the clinic. Patients often feel very disoriented when they're here, and it seems very unfair to have to direct them off to another part of the hospital and send them away on their own. So once the imaging is done in the mammography unit, patients have to return up to the outpatient department. I have known patients to get lost whilst coming back to us. If a biopsy has been taken, they will be given an appointment to come back approximately a week later. If a biopsy has not been taken, they'll be reviewed by the consultant again, the images will be reviewed, and ideally the patient will be discharged back home to their, and results will be sent to the GP. If a biopsy is taken, unfortunately they do have to wait. It takes approximately a week. They will come back to the clinic and the results will be given. If it's a cancer diagnosis, our role as breast care nurses is to sit in on this consultation and then go through the treatment plan with them after this consultation in the hours and days following this. A lot of factors are at play for the individual who has been given a cancer diagnosis, and we as breast care nurses do need a proper space and calm environment in which we can break down all the practical information for patients and give the emotional support that they need. This clinic here is not the right place for this, and this desperately needs to be improved upon.
So we're now down in the mammography department. The patients have taken a stroll, which could take them 3 or 10 minutes to get here. As you can see, we've a limited amount of space for patients to wait. All patients coming here are having either mammogram or ultrasound, or very often a combination of both, and can spend up to 3 hours waiting in this department to complete their study. Okay, so the patients are initially called in to mammography. They have their mammogram done. The mammographer will tell them that they're also awaiting an ultrasound, and they're left in a subweight area with a gown on. Unfortunately, the area is exposed to passing traffic occasionally and is not ideal. They will then come into ultrasound, have their assessment done. Some patients will be found to have something benign or normal. They'll be discharged from here. For those who do need a biopsy, it's done there and then on the same day, and they then return up to the clinic with the result of their ultrasound again on the same day. Our mammography machines are now nearing end of life and will need upgrading, and the plan for the new centre is to introduce a new form of mammography called tomosynthesis, which is better at looking and finding small cancers and is particularly useful in young patients with denser breast tissue.
We spend our days in the breast clinic apologising to patients that they don't have a chair to sit on, apologising about the lack of privacy. This can't go on. We need to change this. Over the past number of years, we have organised many fundraising events to gather much needed cash to build this building. However, we're not fully there yet. We need help. We need your help to raise the last million. For further information on how you can help us, log on to beaumontfundraising.ie.